In this video, we're going to talk about what is a team map. I'm Morgan Price, and I'm a member of the ISU team. What we have here is the map that we use for team mapping. So the whole thing is a circle of care, and I'm going to go through all the pieces of it right now. So first, we want to highlight the whole map, and that is the patient's circle of care. Think of this as the patient's personal healthcare system. It includes all the providers, caregivers, both formal and informal, family members, friends, etc., including the patient. In the center is the patient circle, and that's where we put the persona. And as we map out, we might map into their family, friends, caregivers. The next is the team, and the patient's team is the team-based care team that we're talking about. In primary care, this would typically be the patient medical home, the community health center, the urgent primary care center, the group that you're working with today or planning about today, trying to decide who's part of the team and how that team's going to work together. The outer ring is really important because it provides additional context for how care is delivered. And these are the other providers that are not part of the collaborative team that you're working with. These can be referred services. This could be a merge, a walk-in clinic, the hospital, home care, community agencies. So essentially, those are the groups that are involved that may be referred to, but they're not part of that core team that's there today working together on how they want to work together. That's that middle donut. And the dotted line in the middle, we like to use this line to determine if patients have direct self-access above the line or require some kind of referral below the line. I'll give you a couple of examples. So on the outer circle, a merge would be above the line because anybody can go to a merge directly. They don't need a referral from a physician. Below the line on the outside would be a specialist like a cardiologist or a nephrologist, where a referral is required to see them. Now, you'll know that a referral isn't required for every subsequent follow-up. And then referrals, of course, can vary in terms of their formality. So within a team, you can use this as an interesting workflow distinction if there should be some kind of referral rule, casual conversation in the hallway that triggers the access to one of the team members. And this can be very helpful. I'm going to zoom in here and describe how we use this a little bit more. The persona goes in the middle, and as we talk about the different pieces of the team, the different roles get tagged onto the map. And here we've got three. We've talked about the persona. And then we have the different roles. And then we have the tasks that we attach under those roles. And these will be determined by the team. And they can move between the different roles. And that's an important piece because there's going to be some dialogue and discussion. And that's the very simplest part of how we start using a team map. Pulling back, we also have on our map this section on the right-hand side for gaps, because there's questions that come up that can't be answered, issues that are beyond the scope of a small team mapping workshop. Rather than ignore them, it's better to capture them as a gap, document them on a Post-it note, and leave them there for later. And that is our map. We've tried to keep it as simple as possible to capture the nuances and allow for that dialogue and discussion. And we're going to go into detail showing you examples of how to do this, and we're going to talk about it, and we're going to get you to practice it in the facilitator training. Thank you.